Okay, I think we'll get started. I'm Carol Swallow, and it's my pleasure to welcome all of you to University Rounds this morning, here live in person at the Sinai Auditorium, and also, of course, many of you are joining us virtually online, so thank you for being here. This is an occasion where we're welcoming Husein Moloo back to Toronto for a return engagement, this time as the Palmer Lecturer, and Marcus Seltzner, who's the interim head of general surgery at the University Health Network, will introduce both Dr. Palmer and Dr. Moloo subsequently. But first, I would like to take a moment to acknowledge that the land that the University of Toronto works and operates upon is the traditional homeland of many Indigenous peoples, including the Huron-Wendat, the Haudenosaunee, the Anishinaabeg, and the Mississaugas of the Credit. It is still the home to many different Indigenous peoples from across Turtle Island, and we are fortunate to have the ability to gather, work, and share ideas on this land. We uphold the resolutions of the Truth and Reconciliation Commission of Canada and seek to do better in the future. So with that, we'll kick off the official program, and I'll invite Professor Seltzner to come up and say a few words about Dr. Palmer. Thanks, Marcus.
Yeah, thank you so much, Carol. It's a great pleasure to introduce and to remember Dr. Palmer this morning. It has been 2 years that this lecture was hosted virtually, and I'm glad that today we can come back in a hybrid format with audience in the room and online. Dr. Palmer was born in Meaford, Ontario, and went to medical school actually in Toronto. He briefly, after finishing his medical degree, was a family physician in Milford. Afterwards, he was accepted in the Galley course and trained dual in general surgery and plastic surgery. Based on his dual training, he was an excellent technician and surgeon, and he became an expert and renowned, actually, leader in Canada in head and neck cancer surgery. He was a man of broad skills. He was closely involved with the Princess Margaret Radiation Center, and he became a really sought after consult for people with intestine-induced radiation injury. He was a pioneer of surgery. He was one of the first surgeons to ever do a vertical gastric banding and paving the field of bariatric surgery for generations to come. In addition to all of this, he was also interested in sports medicine. He became a consultant and advisor to the Argonauts in Toronto, and one of the highlights was that he operated the knee, I was told, of Bobby Orr, one of the hockey players at this time, famous in Toronto. Besides all this leadership in surgery, his skills and his vision, he had a second passion, which many of us heard before. He was a devoted painter.
I didn't screen share.
So from his time actually in Milton, he became friends with leading artists in the field, and he kept visiting the countryside as often as he could, pursuing his own dedication in arts and painting, becoming a highly skilled painter and acknowledged person in this time. He did have several highly successful exhibitions himself of his artwork in Toronto in galleries, and was really a man of many skills. Unfortunately, he passed away in 1984 prematurely, leaving behind his loving family, but we'll always remember him for his leadership in surgery, for his skills, his mentorship, his leadership education, as one of us, as a member of our surgical surgical group in Toronto, and it's a great honor to have his lecture after him here today. So following on this, I greatly appreciate Dr. Moloo coming to us today as a Palmer lecturer. He is an established surgeon in Ottawa, associate professor of surgery. He's originally from Toronto, but did his training in Western University in London. Following his education in surgery, He moved to Ottawa first for a fellowship in laparoscopic surgery, followed by a second fellowship in colorectal surgery in Minnesota. In addition, he did 2 master degrees in his training. One is epidemiology in Ottawa, and the second one in public health in Harvard. He is interested and has great work done in quality, and based on his quality work, he became interested in global health and environmental aspects of surgery. He became a leader in the field of planetary health and is now director of the Planetary Health in Ottawa, and also the lead physician at the Royal College of Physicians and Surgeons in Canada for planetary health. It's a great honor to have you here today for us, and we're looking very forward to your talk.
That's all good.
There we go.
Perfect. Awesome. Well, thank you so much for that introduction. And it's a real privilege to be here today, not only to be giving a talk named after such an esteemed surgeon, but also the privilege of spending some time with you today. And what I'd really like over the next 30-35 minutes to just have a conversation with you all about planetary health. I do have some disclosures that I think are important at the beginning of this. I guess the most important disclosure maybe is that I don't have any formal environmental training really in any sense. But regardless, I do get paid for planetary health stuff. And the director role, there's the Royal College role, and then teach a course with the Canadian Medical Association. And I've received some honorariums for some other talks on planetary health. So with that being said, you know, I realized after that there were going to be more than surgeons here, so I've just changed the title slightly because I think this is applicable in terms of, in terms of planetary health and considering it, how healthcare professionals can help save the planet. And as I said, I want to just have a conversation about this. By the end of my talk, I'm really hoping all of you will have a sense of what planetary health is. And you'll have a sense of why it's important in terms of our local, national, international context. And then hopefully you'll have some ideas, concrete ideas, about how on Monday or later on today, you might actually start acting on this. And so, we heard about Dr. Palmer, and he was like an all-around, his all-around game was solid. And on top of that, he was a painter. And one of the things he really liked to paint were landscapes. So this is one of his paintings. It's of Georgian Bay. And when you consider the artistic process, there's a lot of reflection that goes on. And at least that's what Google tells me, because I failed art in grade 7. It's a true story. And so I think, in looking at this beautiful painting, I think he would be reflecting on the environment as he did this. And I think if he were here today, he would be reflecting on the current environment. And I would invite you to just take a second and think about your environment. So, when I think about Ottawa, when you think about things that you enjoy or how maybe the weather and climate is affecting you, right? The Rideau Canal is not opening this year for skating. That is the first time since 1971, when it first opened, that has happened. And, the last summer, we had something called a derecho. And that caused a lot of damage. We didn't have power for 2 or 3 days. It was interesting. I had a chat with the CEO of Ottawa Hydro a few months after that. I was saying, looking at climate change and everything that's happening, it seems like things are going to get more extreme. And I don't think you're going to be able to fix all the infrastructure, right? To protect against this. And he was like, yeah, you're absolutely right. So I was like, what's your advice? And he was like, get a generator. And so, I think, when you think about the things that you enjoy, whether it's things like sriracha sauce that's affected by climate change, whether it's skiing, although we've had a lot of snow this year, but, the things that you enjoy, the places that you enjoy going. You think about last summer. I mean, you don't need to be an expert in satellite imagery to realize that there was a massive drought in the UK and across Europe, that temperatures were super high. So if you're a tourist there, that would be a problem. Or, you know, maybe you extend that further to a place like Pakistan that had flooding with a third of the country underwater at some period in time because of that. And that displaced 35 million people, basically the equivalent of our entire population. And what's interesting is when they were interviewing, you know, some of the senior leaders in Pakistan about, you know, what was going on, their finger pointed back at us. And we're like, you're responsible because of your carbon footprint, because your emissions, because the way you have lived, we are paying the consequences. And I mean, we see this now back in Canada as well. I mean, 20% of homes are uninsurable because they're on the coastline. And maybe it's, you know, maybe you're thinking about, maybe you know younger people, maybe you have kids, maybe you have nieces and nephews, and you think about the world that they are going to be living in. And I don't know what you think about that, but this is a conversation. I know I'm going to like have 98% of this conversation, but I was just wondering, and on the chat, I'd love to see it, but also I hate it when people ask questions of the audience, but we're going to do it anyway. We've got a microphone here. We're going to pass the microphone around, and I just want like 1 to 4 word answers on how does climate change make you feel? And I haven't really tried this before, so we'll see how this goes.
Thanks, Marcus. You know, the commentary you just made saying about the finger being pointed back on the Western world, it's quite embarrassing. And to be frank with you, as we do our everyday business and thinking about, as clinicians, the patient in front of us, we lose perspective on the broader population and the overall impact that we're having in society. So frankly, climate change is an uncomfortable feeling, but the reflections, ones that you just incited moments ago, are pointing a finger on a responsibility, a social responsibility that I think we've taken too long to identify.
So two of the chats, one individual responded scared and the other responded angry and frustrated.
Okay, so 2 people respond on the chat. I hope there's more than 2 people out there. Be nice to get your responses. This is like a poor response so far. I've done a lot of online stuff, but got another answer.
It makes me feel anxious.
Anxious.
My first experience as a lecturer a number of years ago that we had included the UHN lecture, and there's a word, I forget the word is, but solastalgia or something. It's like the fear of the anxiety induced by climate change, and I felt that so much then and since then. So it's my word.
Well, maybe we'll take one more answer from the audience.
Guilty is another one from the chat.
Okay.
Helpless, too late for me. I feel hopeful that we and our children find innovative solutions. We usually do.
Nice.
So I would say it makes me feel disappointed with humanity, because it's like so many other problems that we face, the solutions are actually not all that difficult to envision. In fact, often the solutions are very clear, and it's just the inability of people ultimately to work together to solve problems and set aside any potential differences or interests, which is really perpetuating it. So I think it's our failure as a society of human beings, which is disappointing and embarrassing.
Okay. Well, thank you for all those responses, and thank you for the online responses as well. Just so you know, there's a more efficient way to do this. It's polling software. So you guys may be top 5 hospitals in the world, but you don't have polling software, just saying. And I hear Mass Gen does. So this was a word cloud generated at another place that actually did have polling software. And again, what you see is, regardless of the audience and regardless of healthcare professionals that are that I talk to about this, it's the same stuff that comes up. People are scared, people are anxious, they feel ashamed. It's this is what some people would refer to as eco-anxiety. And if you believe the studies that are out there, and I think some of it is reflected in our discussion here, the majority of adults have eco-anxiety. When you think about that, though, think about the younger generation. Think about the anxiety that they have as they look to the future that they will encounter and consistently look towards leaders, which includes us. And the fact that, as was heard earlier, you'll be disappointed in the lack of action that we take. And so I think, for me, it was that eco-anxiety that really kind of got me going. And a lot of people ask me, like, listen, you're a colorectal surgeon. Why, like, how did you end up talking about this stuff? So very quickly, I started in quality improvement and patient safety. I led that on a unit basis, and then it grew to like a program in our department, and I was vice chair for that. And we worked on the usual stuff like surgical site infection, readmission, mortality. All these things are really important. Actually, all these things are planetary health as well. You reduce the surgical site infection, you reduce resource use, you reduce length of stay in hospital, et cetera, et cetera. So we started a lot of that stuff, but then started thinking, like, how can we intersect QI and patient safety with more kind of big societal kind of issues? And one thing that we did with OnSquin was the decreasing opioid prescribing, because obviously there's an opioid crisis, and as surgeons we contribute to that. And then as our I sat down, we have a vice chair, and then our organizational infrastructure is such that we have division leads for every single division in QI. Sat down and we need another theme. And what is the biggest kind of number one issue? It's climate change. And so when you think about planetary health, so here's what planetary health is to me. Planetary health is the concept that for the people we look after, they need clean water, they need clean air, they need clean food to basically thrive. The ecological determinants of health are exceptionally important. But the other really important notion with planetary health is this whole thing about thinking about future generations. And while in the work that we do, sometimes we consider more than the person in front of us. In QI, we look beyond that person, but can we expand that concept to really think about the generations that will come after us? Are we willing, as was, I think, stated in the first Lancet report, are we willing to mortgage the future of future generations because of us? And is that fair? Is it fair for us to take away the chance for, I don't know, my kids to have a healthy life? And I would say the answer to that is no. And so I started looking at stuff, and lo and behold, there's a lot of people looking at this. Planetary health is something that is it's a growing field, and all over the world, healthcare professionals are concerned. And multiple international organizations have kind of recognized that the greatest health threat facing humanity is climate change. And so you may say, I'm not sure. I don't know if I believe those international organizations. Well, what I did was I asked the all-knowing one. And just in case you thought I'm getting religious on you, I'm talking about ChatGPT. And ChatGPT also, I just my question was very open-ended. I was like, hey, ChatGPT, what are the top problems facing the world right now? And it listed climate change as number one. And unfortunately, colorectal cancer wasn't on there. I don't think bariatric surgery was on there. I don't see liver transplantation on there. And I'm not saying that those things are not important. I think the jobs that we have and do every day are really important and meaningful. All I'm asking or saying is can we start intersecting with the existential crisis that is staring us in the face? And so then you may say, well, do we have a responsibility? So we talked about, earlier, people pointing the finger at us from low and middle income countries. Well, here you go. We thought we were really good in Canada, right? Per capita, we are #1 in terms of carbon footprint. There you go. We are bigger than the US. Okay, so reflect on that. Is there any kind of inherent responsibility that comes with that? And when you think about the carbon footprint, let's also be honest, it comes from people who are of higher socioeconomic status, tend to have a higher carbon footprint. And so as you start to stack stuff up and you look at the education that we have, the privilege that we have, I guess, does that come with social responsibility? And I mean, that's a question that each of you can answer yourselves. But you may say, well, how about healthcare? Well, you heard in Forbes' lecture about a month ago that if you took healthcare as an entity, we would be the 5th biggest country in the world in terms of carbon footprint. So we'd be right behind like Japan and Russia. And so you go, okay, so healthcare has this massive carbon footprint, but you know what? Like in Canada, we're pretty good. Like we're not motivated like some other countries, like just to make profits and stuff all the time. So how are we doing in Canada? We're not the worst, just so you know. We're 2nd worst. So this is from the latest Lancet commission. So in case, just us being Canadian and having the highest per capita carbon footprint wasn't good enough for you, well, we are 2nd worst in the world in terms of our healthcare carbon footprint per capita. Then you may say, well, like, I mean, maybe perioperative services is not the place where it's happening, but unfortunately for all of us, it is. Like perioperative services is a massive carbon hotspot in the hospital. So what I would say to you is that we have a reason to act on this. And you may say, why? Well, look, pick the healthcare or the health system that you care about, and it intersects with it. You care about cancer, it intersects with cancer. You care about, changing patterns of infectious disease, it intersects with that. You've heard about, like I talked about a Duraco earlier. I don't know if that was part of your vocabulary before, but I know like heat domes and atmospheric rivers and bomb cyclones were not part of my vocabulary like more than 3 years ago, but they are now because weird stuff is happening. And maybe that's not your thing. There's the mental health issues that we talk about, like real mental health issues. Like there's reports from psychiatrists in Europe saying like, actually between even kids as young as like 7 to 11, they're more stressed about the climate than they are about homework. And maybe you care about social justice. I mean, we know, and I invite you to look up the literature on this. It is very clear that racialized communities that are of lower socioeconomic status are disproportionately affected by climate change, or by like, pick anything else, any other way we're destroying the environment. Environmental toxins, yeah, that too. And if you want to, again, expand your range, I mean, I showed you that picture of Pakistan at the beginning. Low and middle income countries are feeling this way more than countries like Canada are. So I think there's enough motivation, hopefully, for us to start thinking about this. And so I think a lot of us, hopefully all of us, kind of went into medicine to help people. And, as healthcare professionals, as we start reflecting on all this, as we reflect again on the privilege that we have, on the education that we have, on our socioeconomic status, et cetera, et cetera, et cetera, to really reclaim that heroic status, I really do think we need to start intersecting what we do with Planetary Health. And so question is, how do we do that? So I know this is like, I know it looks like shut text on it. So here's my first suggestion to you. When I was here a month ago, I said, it doesn't actually matter if you have a formal title in an organization. And there's a really good Harvard Business Review article to support that. You don't need a title to drive change. And I'll give you examples of that later on too. We're all leaders, we're all change makers in our own way. And when I've sat down and had individual conversations, when I've had conversations with department heads, when I've had conversations with CEOs, division heads, et cetera, my message has been fairly simple. It is what I just told you. climate change is the #1 threat to the health of humanity. Healthcare has a massive carbon footprint. As healthcare providers, we kind of have this oath to do no harm. So we have like this responsibility to like mitigate these issues and also adapt to them. And because of those things, I consider any vision, whether it's in a research lab, as a CEO, as a vice president of clinical operations, as a department head, I think your vision is irrelevant without considering planetary health. So that's my first message. And I'm sorry, I talk kind of bluntly, but you know, what are you gonna do? So the other thing is I think as we think about mitigation, we could start thinking about a framework like this, which was, you know, developed by an icon in Planetary Health, who's a surgeon, Andrea McNeil out of BC. Shout out to her, she's awesome. And again, you know, when you start looking at this, like, okay, I'm a colorectal surgeon, so let me give you some colorectal examples here. You want to reduce health services? Well, guess what? It's a lot more carbon intensive to give someone neoadjuvant therapy followed by potentially surgery for their rectal cancer compared to removing a polyp. So, you know, can we look at prevention for stuff? You know, as we think about matching the supply of health services to demand, that's really where appropriate care comes in. And there's a great Lancet series on appropriate care. You know, like 30% of the care we provide is totally useless. Like 20% out of that 30% is actually harmful, and the other 10% is just useless. And when you look at the US per year, it's $100 billion annually that they spend on this like inappropriate care. You know, and the reason why that number sticks in my head was because at COP26, when they were looking at a fund for low and middle income countries that are like taking the brunt of all this stuff, it was $100 billion that was needed. Of course, that funding has not been realized, but it could be realized by looking at more appropriate care. And then finally, reducing emissions from what we do day to day, thinking about a circular economy. And there's a ton of different examples of how we can do that. And so, you know, I think one of the things that I'd like, you know, I try and do, and I'd like you to do, is, you know, we said that, and I preface this by saying, I'm a really big fan of philosophy. I really like Stoic philosophy as well. Like I have meditations, and I'll pick it up every once in a while. It's written by Marcus Aurelius, great book if you hadn't read it. And what Stoics do is they reframe. So, you know, the climate change is like the #1 threat to the health of humanity, but reframed, it is also the greatest opportunity for us as healthcare providers to engage with and do something about. And so when I look at quality improvement, for example, this was a reframe of QI. And this is from the NHS, which they've used successfully. And you know, the usual equation for quality used to be, you have the patient outcome over economic cost. That's that was the basic equation. Economic cost used to be the only thing that was considered. Well, now you look at social accountability, you look at environmental impact, and you have the so-called triple bottom line. And when you start to kind of look at stuff that way, it's amazing, like the creative kind of solutions that you start to come up with when looking at the healthcare system. And so for us, our first project in our department of surgery was actually looking at digital faxing. Unlike, you know, I'm sure like a top 5 hospital has already done this, but for us, like we use a lot of paper. And so my office, for example, was going through 50,000 sheets of paper a year. So there was a urologist who started this out, and there was lots of good reasons to do this based on the triple bottom line. Pilot in urology, gets it out to our division leads in QI who had all agreed that carbon footprint was the thing we were going to work on, and it took off. And there were videos created for surgeons, videos created for admins, and guess what? This is like now all through our entire hospital. Now we're not top 5, but we're like a 1,000 bed hospital, and so that's a lot of healthcare professionals no longer using paper. I mean, that's a little win for the environment. You know, a lot of you have done desfloy. I know at Toronto General, for example, the anesthesia department there has basically eliminated desflorin. But you look at this, like, I mean, it's incredible over a short amount of time. You know, it's like 1.6 million kilograms of CO2 that is now decreased year on year. And I think like if you follow this out to this year, I think it's dropped to pretty much nothing for desflurane. Desflurane, just so you know, is an anesthetic gas that has 2,500 times the warming capacity of carbon dioxide. And so again, as you look at the care pathway, you know, whether it's moving towards more reusable instruments, whether it's reprocessed instruments, whether you're looking like at the development, like one interesting idea that we started looking at, again, colorectal example here, but one of the residents is doing a scoping review right now. Actually, it's done. But like, just so you know, give you a bit of context, when you do a colonoscopy in the past, you know, you put in a scope, people would put in like carbon dioxide. It used to be air, now it's carbon dioxide. Then the best practice now is to use water when you go in. Now, the thing with water is like, so I'll tell you as a colorectal surgeon, this may be the one thing I might know more than some of you about, is that the colon and rectum is a dirty place. It has a high bacterial count. But what's really interesting is when we use water during colonoscopy, we use sterile water. It's like a ridiculous proposition. And so we actually looked at a scoping review to see, is there any evidence to like actually say sterile water is better than tap water or anything like that? There's none. And all the stuff that people draw on is like from ERCP literature, which is an upper GI issue, which, as you know, is very different. And then the companies were like, well, no, you know what? Sterile water is really important. Our channels will get blocked. But when you delve into it, actually, the first thing they do when they clean the scopes is they flush them with tap water. So again, it's like all of a sudden when you start looking at stuff, and just so you know, there's like 1 million colonoscopies done every year in Canada. It's like 11 million in the US. So it's, you know, it's really starting to think about stuff. And like even the post-operative pathway, like ERAS, that is Planetary Health. But also, you know, do you think about the food? Like 50% of food in hospital just gets wasted. And that has like a massive carbon footprint. And like, I don't know, whose job is that to fix, right? And so, you know, before I move on and show you a video to help you think about food, I think, you know, we hear these land acknowledgements all the time, and I think they're very important. And Dr. Swallow's land acknowledgement was very nice today. One of the things I want to say is planetary health is not a new concept. Like Indigenous people have been living this for tens of thousands of years. If you want to remember one stat about this, it's that Indigenous people make up 5 to 6% of the world's population right now. They protect 80% of the biodiversity that we have left. So I don't know, like, I mean, like you heard, I mean, I needed 2 masters, like epi and public health, but I can tell you, I don't need an RCT to show to me that Indigenous health or Indigenous thought should be at the basis of what we are doing as we move forward to try and make progress in this area. Now, this picture here, this painting, it's like an Indigenous creation story. And this is Sky Woman who fell from Sky World and landed on the back of a turtle. So you've heard of Turtle Island. And the animals and like there were birds and lots of animals here to help her start Turtle Island. And as you notice, she was pregnant at the time when she fell down from Sky World. And during childbirth, she unfortunately passed away during her daughter's childbirth. So she had a daughter, and during her daughter's childbirth, her daughter passed away. And her daughter obviously was exceptionally important to her. And so from her daughter's body grew the most important plants in Indigenous culture. And so you may think about different parts. And obviously, like one of the most important parts was her heart. And so from her heart grew the strawberry. And so strawberry is a very important berry in Indigenous culture. It's also known as the leader of the berries because it's one of the first ones to bloom. And I thought it would be really interesting for us to look at the modern life of a strawberry. Now, let me see, I want to make sure this plays.
travel the world for you. I love you.
Can we get strawberries?
No, honey.
Please.
Okay.
So that video is what I use as a litmus test to see if someone has a soul. And so my question to you is, if you feel anything for that strawberry, then how do you feel about the 72.5 billion animals who live in horrendous conditions most of the time, that spend their lives basically so we can kind of have a diet that we want? Because I mean, hey, we deserve that, right? I mean, we live in Canada, we have a big carbon footprint, and we should eat what we want to eat. I just want to shout out here for Joanne MacArthur, who's a Canadian photojournalist, won the COP26 award for photojournalism, and she's really cool. She goes to different places and takes these harrowing pictures. Yeah, I mean, our diets in the hospital are meat-based as well. And so again, like, there's hope though, right? So look at New York City. They have now switched all their hospitals to a vegan first diet. And why can't we do that? And whose responsibility is it to do that? It's mine, because I'm director of Planetary Health. You know, is it Dr. Qureshi? He's VP clinical. Is it one of you to take that change forward? But again, it's like, are we going to do this? And yeah, we're, you know, in perioperative services, I still think that intersects with Planetary Health, because our patients all eat after surgery. And you know, like around kind of, like I said, everywhere you look now, people are starting to do stuff. So Annie Lalonde out in UBC is looking at food waste. She's finding about 1 kilogram of waste per day per patient. But you can look at other stuff. You can look at like blood work. You know, we looked at our blood work on our colorectal service. We were getting blood work. Like, listen, as you can tell, I'm pretty bought into the Planetary Health stuff, but we were doing blood work every single day on every single patient. And it's unnecessary. And actually we looked at our current fellows working on it, and she looked at literature. 99% of blood work is useless. It's useless, doesn't add anything to care. So again, like, is this something that someone could look at? And again, we intersect with lots of different things, right? Like diagnostic imaging has a big carbon footprint. Pharmaceuticals have a big carbon footprint. People are looking at all these things. You know, this is from a family physician in Ottawa who basically took the paper off. You know, it covers like the middle of the examination table. It's kind of useless. It doesn't really soak anything up, yet we use it all the time. And she just doesn't use it anymore. And that practice is spreading a bit. And so, you know, one of the things we've done in Ottawa to try and kind of get intersection school, we have a Planetary Health Council, and now we have a lead from every department to see, you know, and it's already yielding some interesting things. Like, for some reason, I'm now, you know, supervising a practicum of an internal medicine staff, and they're working on like reducing the waste from paracentesis and thoracentesis, and they quickly found that intersected with emerge, with like respirology, with like with interventional radiology, and just come up with like, there was never a standardized way of doing it, not a standardized set. She's looking at doing that, and that's going to decrease some waste. And I think these little changes can snowball. And so if you don't want to do anything else, you know, you could include sustainable events. This is from our medical students who just created this checklist. And it's really simple to use. Like, why is it that every department, division, research lab couldn't adopt a sustainability kind of checklist for their events? Talking about checklists, you know, Anita Rao, she's an anesthesiologist, wrote a really cool little editorial in the Canadian Journal of Anesthesia. And after their checklist at her hospital, what they're doing now is a sustainability pause where they takes about 15 seconds and they talk about ways that they may be able to mitigate the carbon footprint of what they're doing. And just talking about medical students, I mean, I can tell you, last time I was here, I was mentioning there's a medical student working with me, Husein, who's doing a leadership elective with me for a month. She looked at disposable gowns and us transitioning to reusable gowns. And, you know, we looked at the triple bottom line, and it works on every single portion of that triple bottom line, including the economics, which is what hospitals care about. It is cost saving. And you may say, well, how about the washing stuff? Yeah, that argument's done. There's no reason to use disposable gowns. We could share that slide deck with anyone. And we had a meeting 2 days ago before I came here, and the Ottawa hospital is switching. So that was driven by a fourth-year medical student without any kind of title, just reaching out, having conversations, and that can lead to powerful things. You know, another conversation I had was with, you know, we have residents, and it's, you know, we haven't really, I think, utilized their brain power and motivation as we could have. And trash is something that was started in New Zealand and Australia by anesthesia trainees. They started out with 3 at the beginning of the pandemic, and now they're up to 500 trainees involved just in anesthesia across 100 centers. And so we had a chat with them, and we're like, hey, what should we do? And the first thing they said is, hey, we've got a good name for you. It's called Trash Can, you know, and so we're like, that's perfect. So now we have to do this. And, you know, we've got this website, and really what we want it to be is a platform to enable conversations. So trainees who are interested can have a chat with someone who's interested in sustainability and actually do something. Because the one thing I'll tell you is that when we backtrack to that story about that medical student who shifted, you know, disposables to reusable gowns, one of the coolest things is she said to me that is like the most meaningful thing that she has done in her 4 years of medical school. And the other cool thing is that the VP of like operative services, when we had a chat with them, they said that this project would also win the most meaningful thing they've done the last 2 years since they took over that position. So it's just, it's tapping in to the things that we all feel. And that's why I think conversations are really important. And that's why I really value kind of being able to take up, you know, 40 minutes of your life today to have a conversation with you. And, you know, I just want to tell you, like, you may think like the ripples from conversations, I think, can be very powerful. At the Ottawa hospital, you know, we started chatting about this. I remember sitting down with the CEO, giving him the like irrelevant vision spiel. That's the poster of our new strategic vision. And I don't know if it's projecting well, but at the middle of that, there's an earth. And so sustainable healthcare is part of our strategy. You know, I had a chat with the CEO of the Royal College because I was looking for help in terms of what was the Royal College doing about planetary health. And lo and behold, they weren't doing anything. And so, but they wanted to. And so guess what? The strategic vision for the Royal College from 2023 to 2025 has planetary health as a part of it. And just so you know, trainees, CanMeds, the next version of CanMeds 2025 is going to have planetary health in it. And I can tell you, as someone who burns a week of my year putting together the general surgery licensing exam, now we'll be able to test people on this. And we know when we can test people, they actually read it and pay attention to it. And the first TPA was created in colorectal surgery because we're just going through our CBD stuff now. We're late in the process. So it's happening, and people are getting engaged with this. And finally, the American College of Surgeons, like I was looking at them for help, they're QI. And you know, so again, Cliff Coe, who runs NISQIP, didn't know what this was, but to his credit, we had a conversation. I sent him some articles, he read about it. I gave a talk last year, and this year we have a planetary health track at the ACS quality meeting, which is kind of cool. And at that ACS meeting, I'm going to have Tim Jackson present, because what's really cool about today is that it is the official launch of the Cut the Carbon campaign for OnSquin. So OnSquin, if you don't know what that is, it's the Ontario Surgical Quality Improvement Network. It has 50 hospitals across Ontario doing greater than 70% of the surgery in the province. Our province has 15 million people. It includes all 5 children's hospitals. And we pick a theme every few years. And so again, when I became Director of Planetary Health, I know Tim, I had a conversation with him. I know he's a great leader. We talked about this. He got his executive involved. We knew Cascades. We got Cascades in there. We got, people who are motivated, like Dave Smith involved, a surgeon at here in Toronto. And now Cut the Carbon is happening. I think that's pretty awesome. And so, when we think about that word cloud, and I haven't forgotten about that one comment in the chat, which was hope. Because when you look at the spaces between those words in the word cloud, I see hope. And what I really hope is that when you leave this auditorium and go on back to all the great surgical and life-saving stuff that all of you do, that I really hope you think about how what you do can intersect with planetary health. And as you think about that, I'd also have you reflect on Marshall McLuhan's quote. He's a modern Canadian philosopher. And that is that on Spaceship Earth, there are no passengers. We are all crew. Thank you for the privilege of spending time with you today.
Thanks so much for a really inspiring talk, Husein. I know we have some questions and some comments from the chat. So maybe we'll start with that. And then if anyone has a live question, we're very welcoming of any comments you have.
Yep, so I'll start off with the comments first. One earlier read, feel like hospitals contribute far too much to this. We have Epic and still receive paper results in the mail from across the street on blue paper. Another comment from an individual, 2023 Canadian Anesthesiologist Society Practice Guidelines has now incorporated a section on sustainability. And then individuals have indicated that this is a great talk. The first question we have online, yes, we can all do our bit, but isn't our bit so small it won't make a difference given the big issues, China, fossil fuels, methane from cows, etc.
Well, that's a small question.
Yeah. So no, you know what? Thanks for that question. I think it's really important to think about, right? And I think I always mess up these levels. And so some senior leader here can correct me, but there's the micro level, there's the meso level, there's the macro level. And you're right, like there's some issues in China, but if you look at what they are doing, so let's just talk about China since you mentioned it. There's a lot of actually really innovative things they are doing in green space in terms of sustainable energy that is actually quite laudable. And so I think China also realizes that there are big things to be done. If you look at pollution in their major cities, especially when they started to clean stuff up after the Olympics, they've actually made a pretty significant impact there. But when we look at us, like you might go, okay, at the micro level, why does that matter? Well, I think social signaling does matter. We're all part of like networks. And like I was saying, we all have these conversations that we can have. So, one example I gave this time is like when we went out for dinner last night and when we went out for dinner a month ago, they were at vegetarian restaurants, and so at a micro level, maybe that doesn't mean much, but again, I think it starts people thinking about stuff. And then when you look at like the higher level, when you look at a hospital or a department, these things I think start to snowball forward. And then you look at like kind of the more macro level and you look at, okay, the Royal College, like maybe you don't think having this on CanMed is a big deal. That's okay. But then, what's also cool is through the Royal College, there's something called a National Adaptation Strategy that Health Canada has with the government. Well, guess what? We were able to put together like a document, which I submitted to the National Adaptation Strategy. And we met with the federal minister of health, like it was about a month ago, to talk about partnering on stuff like that. And yet, like, is that going to solve the problem? No, it won't. But I can tell you two things. One is one of the best things for eco-anxiety is eco-action. And so even though I feel all those emotions on a word cloud, the thing in the chat about hope, that's what I try and carry forward. And I'm thinking like, I mean, if me as a guy who has no background in environmental anything, and I know the people who are in the audience, some of them here today, they are way smarter than me. And so if I can do this, and if other people get involved, and then, you know, younger people get involved, then I think like it actually is really powerful. And so I refuse, I guess, to give in to defeatism. But I think the point you raised is really good. And thank you for asking that.
Yeah, we have a question.
Hi, Colin here. We've spoken to nice to meet you, sir, in person for the first time. So as you pointed out, overuse from a clinical and economic perspective is recognized as a major issue for decades now. There's been many efforts, huge institutional support to address this issue of overuse, as you pointed out. How successful have we been at dealing with this issue of overuse on a sort of national scale in Canada and the US? And what does that present for new efforts to turn the lens of overuse onto this ecological dimension?
Yeah, thanks for that. And by overuse, do you mean like kind of like the appropriate care stuff?
Yeah, so choosing wisely. That's
Yeah. So I think, as you mentioned, actually, like, you know, choosing wisely is a great organization. Now the question is there's like, have we made any headway? Yeah, I think we've made some headway, but there is still a massive delta there that I think all of us can work on. Like I said, I mean, from small pieces, and it seems small, but like these things around, like say, like blood work or imaging can really kind of snowball forward, especially as we get, you know, if we can get provincial and national organizations around it. So, you know, you bring up a great point. I think it started, and I think people are starting to realize this. And I think there can be, for some of these changes, I think when you add in the extra motivation of its intersection with carbon footprint and planetary health, I think that gives people more intrinsic motivation to change sometimes.
I think we'll do a chat first.
So one of the individuals online has asked, what responsibilities do patients have? For example, do they have the right to pick their inhaler, or should physicians switch the prescription to the equivalent green choice? Also, what about conference travel? How ought we manage the huge impact of air travel as a society of professionals rather than as individuals working on our careers?
That's Karen Devon. Shout out to Karen.
Yeah. So both great questions. The conference question is sticking in my mind first, because there's the latter half of that statement. So yeah, you bring up a great point. You know, last year for the CAG's kind of registration, we had something right there where people could offset their carbon footprint based on their travel, and suggested what they could kind of hit in terms of you know, donation, in terms of it was with like a organization that did like tree planting or something. So there's that. Is it perfect? No. Is it something? Yes. Do we need to have a fundamental shift in how we look at some of this stuff? Yeah, we probably do. Can we look at like regional hubs for conferences? Has been suggested in some literature. I think we do. I think we're social animals, and I think the in-person kind of meetings really, like they do create a vibe that is very different from being online. But I do think we need to continue to push our societies. So at Canadian Surgical Forum, actually this year, our whole kind of our theme is planetary health. And actually maybe that would be a great debate, because we have debates at Canadian Surgical Forum. And I think a debate would be, next year, should the Canadian Surgical Forum be hybrid or have a regionalized model? And like, yeah, it's tough choices and it makes it tough on us. But then like, you think about the inhabitants of like Tuvalu or Kiribati, whose islands are actually going to be submerged and they won't have anywhere to live. And I don't think they actually care if you enjoy in-person interaction more. So, and the other part of that question was
responsibility.
Patient's responsibility. That's a difficult one. I mean, that comes down to like individual responsibility, and like, should they be forced to use like a meter dose? I mean, a powdered inhaler versus meter dose. I mean, I think, their patient autonomy is always there. I think it's like anything else in medicine. We can advise and give a very clear opinion on why we think they should be using powdered versus, let's say, a meter dose inhaler. And I think our advice is respected, because I think one of the other things to remember for all of you is that as advocates out there, healthcare professionals still have a very kind of respected status in society compared to politicians and, lawyers and stuff. So, we are trusted and respected. And so when we give that advice to someone as a patient, I think they take that very seriously.
And just Dave Smith is commenting online about patients' willingness to give up single-use plastics, probably more than we are. So thanks for that comment, Dave. In person, David.
Yeah, thanks. So this may seem like a bit of a tangential question, but it's related to the theme of sustainability and equity and social justice. In particular, the way we practice some typical models of care and surgery. And I know in Ottawa, a lot of the surgical divisions and programs practice in a more innovative model of care, using team-based models, shared care, central intake, etc. I'm wondering if you can comment at all on how that works in Ottawa and what the potential is for improvement and sustainability for the rest of us.
That's an interesting question. So I personally also, I work in a group practice. So all our patients are essentially owned by our whole group. And so, how does that intersect with Planetary Health? I think there are efficiencies in care that can be realized. And that's what some of the literature, when we've done a scoping review on this, has shown, that if you get, again, the right group of people together, it actually can drive down costs and makes things more efficient. It leads to better, when talking about appropriate care, leads to better decision-making, not only based on that, but if you look at, again, business decision-making at articles on Harvard Business Review, because you have multiple people thinking instead of the one person with their potential dogma about certain things, it really kind of can lead to, I think, better things that way. And then also stuff like this, when we want to make a change, decreasing blood work, it's very easy when you have a group, because it gets downloaded right away, as opposed to having 50 trillion conversations about it and listening to, everyone's ideas about why blood work's needed once or twice a day or something. So thank you for bringing that up. And I'd like to shout out to Ottawa and the group practice model. I love group practice.
One more in-person question. Alan O'Connor.
Amazing and inspiring talk to say. Many of your examples, you referenced the environmental benefits that aligned with, when you looked at them, the economical advantage as well. What strategies or situations have you encountered where those don't align and the environmental decision costs more? How do you address that, or how do you convince hospitals to do the right thing even if it costs more?
Yeah, that's a great question. I guess kind of finish on. I think, number one, a lot of green type interventions, for lack of a better word, they're usually economically better because it's more efficient care, or whatever we're doing, just, it's using our resources better. There are some things which require a bit of an investment, which in the long term pay off. But again, people are on very short cycles where they don't think about that. But I think that's where incorporating this into strategic visions and missions then gives us an opportunity to point back to what is the North Star of an organization? Where do they want to go? And I think most organizations more and more will hopefully say they want a better future for everyone. And so I think that makes it sound a little bit easier.
Oh, I guess it's okay. So I want to thank you, Husein, for both visits and for the town hall that you ran last time, which did instigate some action, you'll be glad to know. It was an amazing sort of kickoff to our own program, and I'm sure we'll be having more discussions, Tim Jackson and Sarah Ward and I, about where we're going to go as a department, with you hopefully consulting. I also want to tell people who entered chat messages that we have recorded them and we will communicate them to Husein and he will answer you. Thank you for your participation. Thanks to everybody who came today and to those of you who attended online. And also shout out to the group at UHN for hosting Husein for the Palmer Lecture and Hilary Gandy for making all the arrangements, and the crew from the Stewart Building, Sylvia, Sahar, and Chriselle, as always. Excellent work. Thank you, everybody, for being here.
That was okay.
Yeah, it was good. It was good. It was actually at one point.